It's a graphic sight, coffin after coffin placed near newly dug graves in Brazil for the victims of COVID-19. A staggering 1 million people have lost their lives, a figure many of us never would have expected when news of the virus first broke in January. But the number's not surprising to scientists.
In countries like China, India, the United States, Brazil, all of which have very large populations, go down with the virus, then you're going to reach large numbers, the million mark, which is quite psychological, I think, quite quickly. It's probably come about a bit quicker than I'd anticipated. If you'd asked me back in the spring, I would have thought later this year, perhaps a bit closer to Christmas.
Although the numbers of people dying seem to be much lower than earlier in the year in Europe, the virus is as virulent as ever. But limiting social contact has reduced infections and also deaths. And scientists understand COVID-19 a little more, especially the risk factors for severe disease, such as age, ethnicity and obesity. So doctors now have a better idea of who's likely to get it, to suffer more and need intensive care. Trials of suggested therapies have been vital in working out what to give to patients. So that's meant no to hydroxychloroquine and yes to dexamethasone, as long as it's given to people at the right time when they come to hospital.
If I gave dexamethasone to somebody when they're not necessarily that ill, actually that might increase the risk of dying. But if we reserve the dexamethasone for people who are really very ill and therefore have quite a high probability of dying, then the dexamethasone can reduce the risk of death by about a quarter.
Does that feel okay?
Even if the virus doesn't kill, scans of infected people have shown it can cause long-term damage to major organs in the body. And younger people, initially thought to be practically immune to COVID-19, are among the hundreds of thousands suffering from long COVID, where symptoms last for months. So how many more will die? Scientists say that depends on how long it takes to get a vaccine, how effective it is, and how quickly it can be manufactured and distributed worldwide. Nicola Hill, TRT World, London.
Well, for more on this, we're joined by Dr Andrea Feigl from Vienna. She's a health economist and CEO of the Health Finance Institute. Welcome back to the program, Doctor. Now, we have a grim milestone, 1 million deaths since coronavirus was first discovered less than 9 months ago. Could the world have avoided this rather high death toll from the disease?
Thanks so much for having me again, and I'm sorry to join you at such a terrible hallmark, really. And I think that obviously, I think a lot of things could have been done to prevent this horrible death, as well as economic toll, in terms of wearing masks and really acting faster and sooner and perhaps more drastically at the beginning. But, you know, here we are, and I think we learned a little bit more about the virus, about the consequences and what to do. So I think that hopefully we'll be able, until we have better vaccines and treatment measures, to contain it. And that's so important, both in terms of the health outcomes and future, as well as imminent economic measures and growth as well.
Now, we know the United States reached a death toll above 200,000 people last week, more than any other country in the world. We also know the US has the world's highest number of coronavirus infections in the world. How would you judge the Trump administration's response to the pandemic overall?
I mean, I think the numbers speak for themselves. I think every life lost is one life too many, and we're at 200,000 right now, and the worst predictions said we would be by 200,000 by the time of the elections, and here we are still a couple weeks out. So I really think the administration has dropped the ball and tried to catch it too late. So from a public health perspective, they don't really get a passing grade here, I have to admit.
Now, as we heard in Nicola's package, the infection rate and the death rate has slowed in many parts of the world, but as we know, infections are still surging in other parts. How worse could it get? How much more worse could it get, I should say?
I mean, I think it's this dance between the trade-offs of having very drastic measures that have health impacts and economic impacts in and of themselves, and finding that right balance. But at the same time, I think until we know more and have specific treatments, and that is a vaccine available that's proven effective and really accessible, we have to be on guard. So, and if we're not, then we'll see again that we have to act quickly. I recently temporarily relocated to Europe in Vienna, and France right now has a soft lockdown, and for example, there are new travel restrictions, and I think that we have to move away from politicizing the virus to acting quickly when case numbers rise again, because due to exponential growth, which means that when our number is bigger than 1, every infection will cause so many more, and the numbers will rise faster than we can act. So I think that the sooner we act, and the more we stay on top of it, and the more and better we communicate, the more we can contain it, but then also open up economies there. So hopefully June 2021, July 2021 is when we have a vaccine accessible, and until then, I guess it's, we will see our real faces only over Zoom, and otherwise we'll see ourselves via masks.
Yeah, let's talk more about that, because I was going to ask you about the prospect of a safe and effective vaccine. I think a lot of world leaders are hoping that one could be deployed before the end of the year. You're saying we really won't see one for the masses until the middle of next year. How close are we from actually getting a safe and effective vaccine in the first place?
So I know there are different predictions right now, and it is very likely that a larger rollout to at least the high-risk populations or healthcare workers could occur at the end of the year. But because you need to make sure that you have safety, you need to ramp up productions. I think when you look at real, availability, the same way that the flu vaccine is available to pretty much everyone who wants to get it, we're really looking at at least spring 2021, and late this year, if we're very lucky, for a select group of people at highest risk and highest exposure.
Okay, Dr. Andrea Feigl, we'll have to leave it there, but thank you again for joining us from Vienna.